Today I'm going to talk about the root cause behind most cases of high blood pressure, and the one mineral that may be playing a much bigger role than most people realize. Around 90% of people with high blood pressure are diagnosed with something called essential hypertension. That basically means the exact cause is unknown. It's also called idiopathic hypertension. Now think about that for a second. If the cause is labeled unknown, treatment usually focuses on managing symptoms, not fixing the root issue. And blood pressure medications are among the most commonly prescribed drugs in the world. So first, let's understand what high blood pressure actually is. When you see a reading like 120/80, the top number, 120, is called systolic pressure. That measures the pressure in your arteries when your heart contracts and pumps blood out. The bottom number, 80, is called diastolic pressure. That measures the pressure when your heart relaxes between beats. Together, they represent one heartbeat cycle. When blood pressure is high, it usually means there's resistance somewhere in the circulatory system. That resistance could be due to stiff arteries, inflammation, stress hormones, insulin resistance, or other underlying issues. And when resistance increases, the heart has to work harder. Over time, that extra strain increases the risk of heart disease, stroke, and kidney problems. Now here's where it gets interesting. A large body of research shows a strong connection between low potassium levels and high blood pressure. In fact, many experts agree that most people don't get enough potassium. The recommended daily intake for adults is around 4,700 milligrams per day. That's a lot. And the average person doesn't come close to that amount. Medical advice often focuses heavily on reducing sodium. And yes, lowering excess sodium can help. But what's rarely emphasized enough is increasing potassium. Your body works best when there's a healthy balance. Lower sodium, higher potassium. But in modern diets, the ratio is often flipped: high sodium, low potassium. In some cases, people consume 3 times more sodium than potassium. So what does potassium actually do? Potassium helps regulate the tone of your blood vessels. It supports proper relaxation of the arterial walls, which helps reduce resistance. It also plays a role in balancing stress hormones like adrenaline. When you're stressed, your body releases adrenaline and cortisol. Both can raise blood pressure. Potassium helps counterbalance those effects. It also improves insulin sensitivity. And insulin resistance is closely linked with hypertension. Now here's something many people don't know. If you look at several common blood pressure medications, some of them actually work by helping the body retain potassium or prevent potassium loss. That's interesting because it suggests potassium balance is extremely important in blood pressure control. When people try to supplement potassium, they're often surprised. Most over-the-counter potassium supplements contain only 99 milligrams per tablet. Compare that to the 4,700 milligrams your body needs daily. You'd need dozens of tablets, which is neither practical nor recommended. So where should potassium come from? Food. Leafy greens, avocados, spinach, beans, squash, sweet potatoes, and other vegetables are excellent sources. A large daily salad can significantly increase potassium intake. Vegetable smoothies are another practical option if salads feel difficult to eat regularly. And here's an interesting perspective. Anthropologists estimate that prehistoric humans may have consumed between 11,000 to 15,000 milligrams of potassium per day through whole, unprocessed foods. While exact numbers are estimates, it's clear their diets were very different from modern processed diets. Today, refined sugar and highly processed foods dominate. Refined sugar can increase potassium loss. Chronic stress also increases potassium depletion, so here's a simple challenge. For 1 week, increase your potassium intake naturally through whole foods. Focus on vegetables, leafy greens, and potassium-rich foods. Monitor your blood pressure and see what changes. Important note: if you have advanced kidney disease, especially stage 4 or 5 chronic kidney disease, Increasing potassium without medical supervision can be dangerous. Always consult your healthcare provider if you have kidney issues. But for most healthy individuals, improving potassium intake through food is one of the safest and most powerful dietary changes you can make. Try it for 7 days. Track your numbers, see what happens. You might be surprised. Thanks for watching, and I'll see you in the next video.